Good morning. So I'm going to go over just a few more things with you before we get started. So it sounds like you have just a general hamstring strain or tendinosis, or even just a trigger point in there. The hamstring is a very normal injury. Sometimes it just shows up out of nowhere. It happens when you have like a single incident that hurts it, like a trauma or a trip and fall. Sometimes the muscles get really tight, just like in this protective mechanism. But you said that didn't happen. And then the other times, a lot of sitting actually does it, and especially when you're driving, because like you're sitting on the one side more than the other and sort of thing. And yeah, chronic sitting, like we talked about, generally not the greatest, and this happens all the time. Happens to me quite often. So very normal, very easy to fix. Can be very painful, and part of the treatment might be painful, so just keep that in mind too. So my first note is going to be how to stretch it, but actually before that, the anatomy. The hamstring crosses the knee joint because it actually starts down here, goes this way, and there's three of them, and then it comes up here, and it actually goes under the butt cheek where the butt cheek ends. There's this bone called the ischial tuberosity where it attaches, and it's actually deep, so if you were in the clinic, I would actually end up lifting your butt cheek and then trying to get my hand under into the bone. Very awkward, but if you do it to yourself, like feel your butt at the low part, you'll find the bone, kind of lift the butt cheek, and then go deeper, and you'll find this bundle of fibers that goes in this direction. That's the hamstring. The reason why that's important is because I'm going to have you find that in a couple minutes and then do something with a lacrosse ball. So, first note, the stretch. You're going to find an elevated surface. A couch will work, a chair would work. Even something just a couple inches works as well, but I find that this works best. And if you have a chair, extra benefit is you have something to hold on to. So you're gonna take the side that hurts, and you're gonna find that a lot of people like to stretch the hamstring with the knee bent. That's gonna get more down here. But you're saying the pain is more up here. So what you do is you go from the extended knee, and you kind of lean into it, and you kind of sink into it, hunt around, find that position where it's like, oh, I feel a stretch or a mild pain. So from there, what you're gonna do is you're just gonna kind of sink into it a little bit, use the chair to kind of hold yourself up if you need to, and you're just gonna find that spot. And then you only wanna find a mild stretch. You don't want an aggressive stretch, there's no need for that. So once you find the spot, again, you might have to hunt around side to side, you might even have to rotate your hips a little bit and find it. But once you find it, sit into it for 2 minutes, wherever your phone is, or if you're looking at a clock. You're just gonna chill there for 2 minutes, and then once it starts to like let go or the pain decreases, sit into it just a hair bit more. Again, nothing too aggressive. And then the important part, you wanna slowly come out of it, so you don't lose your balance and you don't piss it off. So it's probably best to do both sides, 2 minutes each. Very gentle stretch. The second part is going to be lacrosse ball flossing. So this is what they look like. I couldn't remember if I gave you one or not. I give people them a lot because we have a bunch and they're super helpful. So you're gonna find a hard surface. A couch won't work for this, but a chair, like a wooden chair, will work. Even if it has a little bit of cushioning, as long as it's hard enough that you can sit the ball on it and it'll press back on you. That's perfect. So what you're gonna do is, you're gonna, again, find the bone under the butt cheek. If your hip is here, if you go like one hand length down to the pinky and kind of follow that back, you'll be just above or just in roughly the right area. Go around, lift the butt cheek, and there's the bone, there's the muscle. So once you find the bone, you're gonna go down an inch or two to the muscle. That's where you're gonna put the lacrosse ball. It's important that you don't put the lacrosse ball on the bone because that's just gonna hurt. You wanna get the tendon, which is what attaches to the bone. So again, another inch or two off the bone and you'll be fine. So you're gonna find it, hold the ball there. You're gonna sit on it, and this can be incredibly painful. Hunt around till you find that anger spot, and then put some weight on it. Start very slow. you might want to do a graded exposure. And then what we're going to have you do is extend the knee, bring it back nice and slow and controlled on that spot. This is also going to be extremely painful. You don't have to extend your knee all the way flat. Just go as far as your knee will let you, or as far as the pain lets you. We call this lacrosse ball flossing, because you're going back and forth like you're flossing with your knee. And the important part is once you're out here, to the best of your ability, again, the pain might stop it from doing so, but extend the knee, hold it for a second. You might shake, you can't see it, but I'm shaking right now. And then you're gonna come back, and then you're gonna go forward, and you're gonna come back. And so do that for, let's say 30 reps. So 1, 2, 3, 4, all the way to 30. Wherever the ball hurts, that's the good spot. If it doesn't hurt, you're gonna wanna move it and find another spot. If it relaxes or releases in the middle of it and that spot no longer hurts, kind of move around to another spot and then continue and finish your 30. So do this one set of 30 after the stretches, and then we're gonna move on to the next one. So the next one is a chair assisted hip extension, kind of like a deadlift. And the important part is going to be going very slow and controlled. So you're gonna wanna find a chair, particularly with a high backing if you can. Really any stationary, stable object will work. If you have to use a wall, that's fine too. I think a door would work, but really anything just to hold on to. So what you're gonna do is you're gonna stand maybe a body width away and hold on to it. Get your feet roughly shoulder width apart, not particularly important. The important part is to keep your feet straight, roughly. Hold on to this, stand straight with good posture, and then what you're gonna do is you're gonna push your hips back, 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 until you feel your hamstrings catch. You might only have a little bit of range of motion, and that's fine. And then what you're gonna do is bend your knees just a little bit, go back as far as you can, and then you're going to, using your hips and your hamstrings, bring yourself back up. Put some weight on the chair. You can actually see that I have it pushed against a couch, just so it doesn't slide away. The most important part of this is going to be safety, because sometimes things slide. So the basic motion, like we talked about, is going to be hips back and bending the knees. You're going to go very, very slow, count to 3, pause for a second, and then using your hips more than your arms, you're going to come back up. One more time. Again, don't be afraid to put weight on the chair, but try to put as much weight as you can into your hamstrings, and then back up. So one last tip is, like you said, going back slowly. You want it to take about 3 seconds, just very controlled. You want to feel the hamstrings lengthen, and we're basically using them, teaching them to be used. And then you want to pause at the bottom, and then using as much of your hips and your hamstrings as you can to bring your body back up. Let's have you start with 3 sets of 10 for those. And as always with everything else, let's max everything out at a 4 out of 10 pain. So if you reach a 4 out of 10, then stop what you're doing. But anything below that that's just kind of irritating, or I'm getting nervous, don't worry about it. Totally fine, totally normal pain. Sometimes you do have to work through pain, which is annoying, but it'll be okay. So the last one is basically, we're gonna have you use the same muscle like we just did, but there's gonna be no weight, and you're gonna do it for very, very high reps. And the idea behind this is to get what's called a pump, just like really push a lot of blood in there. It'll also kind of wake it up you'll start feeling it throughout your day, and you'll be like, oh, okay, I am aware of this muscle and how to use it and all that. Very important muscle, very big muscle. So again, with the chair or really anything, this time you're actually gonna put a lot of weight on it. You could use a couch. You could do this kneeling or even laying on the couch if you need to, but essentially what I'm gonna have you do is adjust this. So again, make sure it's stable. You're gonna bend over just a little bit. You're gonna take the affected side, right? And keeping your knee as straight as you can, you're gonna kind of just kick behind you, bring it back. You're gonna kick, kind of pause at the top and come down. You might find that it's more comfortable with a bent knee, in which case you're gonna get a little more glute action with the bent knee than the hamstring. That's fine too. You're still gonna hit the hamstring, but do start with the straight leg as best you can, and if it's anywhere in between, totally fine as well. So, you kick, pause, bring back. Kick, pause, bring back. You're gonna do these for anywhere between 20 to 50 reps. Go as far as you can in the reps. Again, once it starts to hurt, give it a moment to relax and then continue. You can do all 4 of these things, pretty much any time of day, minimum once a day. It'll probably take about a week for things to start really relaxing and starting to feel better. Might all start feeling better immediately, that's fine too. Everybody's different, depends on the severity. So, quick recap is going to be the stretches that I showed you, the lacrosse ball flossing, this one. You're gonna have the chair assisted deadlift, or hip extension rather. This, slowly pause, come back up. And then the last thing, like we just talked about, is going to be the standing hip extensions.